I'd like to introduce Nicole Batsch. Nicole's worked in, as an academic in dementia for a long time and written some of the ADI world reports. And I'll hand over to you, Nicole. She's going to talk today about dementia-friendly communities defined, key components for a successful start.
Yeah, thank you, Kate. Just to clarify a bit, I haven't been an academic for a very long time. I'm just a PhD candidate, soon to be finished. And my experience is mostly from practice-based, working for Alzheimer's disease-related organizations in the US and the UK, and now, luckily enough, as a consultant for ADI, which I'm very happy to do while I'm getting my PhD. So I appreciate you inviting me here. I think the last time I was here, I did talk about the World Alzheimer's Report 2012 that I was involved in writing, co-authoring with a couple other people, Mary Middleman and some people from the ADI office, and that was a real pleasure to be here. So today I get to come back and update you all on some other work that I've been doing and actually share the work of others, which is something I really enjoy to talk about, because dementia-friendly communities is an involvement project of a lot of people around the world who are getting involved in trying to make the communities better for improving the quality of life for people with dementia. So let me share my screen and we'll get started with the presentation. Share screen. Okay. Can everybody see that? Kate?
Yep, great. Thank you.
Okay, good. So the title of the presentation is Dementia-Friendly Communities Defined, Key Components for a Successful Start. And what I hope to cover, if, there it goes. I'll give you an overview of the project that I was involved in here in England. The England Alzheimer's Society, who has over 60 dementia-friendly communities around the world, I'm sorry, throughout England, got together and worked with the Department of Health and the Alzheimer's Society, the Department of Health, and British Standards Institution to write a British standard for dementia-friendly communities. So I'm going to talk about that project, how I was involved in that project, and some of the outcomes of that project to kind of set the stage for defining dementia-friendly communities, especially now as they are starting to replicate around the world. I think having a common definition might be useful to people, and talking about the debates around that definition and some of the controversy as well, briefly, and really kind of giving you guys an idea of the process of what creating a dementia-friendly community is. If you're in a community that isn't already becoming dementia-friendly or working towards it, or you're serving on a committee for it, then perhaps you know this will give you inspiration to go and work with some other local stakeholders to get one up and running in your community. The different areas for action that we debated and discussed. We'll talk about the issue of working towards becoming dementia-friendly, and then give just a couple brief examples, because I wonder if there might also be people on the call who might want to share examples from their local community, some international resources, and then some Q&A and discussion. So that's the plan for today. So like I said, the project overview, this is about the PAS 1365 2015 document. It's a code of practice for the recognition of dementia-friendly communities in England. So just to give you an idea, within England, if you're not from here, haven't been to England before, they're facing about 850,000 people with dementia in the UK, with their numbers set to rise to over 1 million by 2025. Interestingly enough, they've also done a lot of research with people with younger onset dementia in this country, and they've estimated about 40,000 people under the age of 65 with dementia in the UK. And they've also estimated their minority populations at more than 25,000. So these will be key issues that will be brought back as I talk about the presentation that I'm going to give. So what happened was the steering group got the three partners, Alzheimer's Society, Department of Health, and British Standard Institution got together and pulled a committee of 18 members together, including a person with dementia. But you can see the members of the committee here and all of the people that got together who were invested in trying to make this British standard, this code of practice, the best of current standards, as we can say, to what dementia friendly is today. Okay. The consensus process is really run by BSI. It requires that the consensus process takes place before the standard, or in this case, a code of practice, is published. And that's what that committee was about, that steering group. The language of a code of practice is different than a language of a standard. The language of a code of practice uses the word should and not the word must. So an official standard would use the word must, which means, you know, things must happen this way or you could be sued if they're not. We didn't think as a committee that we could tell other organizations and communities and cities and towns exactly what they must be doing, but we could give recommendations on should, which is why this particular document is called a code of practice and is not of the highest standard of a British standard, which would use the word should and which would use the word must instead. And we do know that and we had a lot of discussion about this, the document would be updated every 2 years as dementia-friendly communities evolve. Because right now we're still at the early stages in many countries of dementia-friendly communities. But I think as far as what I've seen around the world, the UK and in England in particular is the furthest along with the infrastructure they've put in place for dementia-friendly communities. So what was the task for the steering group? The steering group was meant to agree on the basic foundational recommendations on what makes a dementia-friendly community. They were committed to ensuring that dementia-friendly communities remained a fluid process. Again, that word should and not must means that it's flexible and it can move with the community, that it would be very local and unique to local communities. So again, that flexible, local, and appropriate within the infrastructure and availability and resources of what local communities have, because every community is different, not only around the world, but certainly different within England as well. So the document underpins that it's people with dementia who should choose what comprises the tasks based on the area of community in which they engage. So people with dementia are integral to the process in the UK and in England, and that's something I've been really impressed with. And the other thing I wanted to mention was that health and social care are just two of the sectors involved. I think when a lot of people think about dementia, they automatically think of the medicalized version of, you know, getting the diagnosis at the doctor and what social care programs are occurring and happening and helping people, and how, and then of course care homes and nursing homes come to mind. You know, so it's really health and social care related. Dementia-friendly communities are really much, much more than that. Everywhere a person with dementia might engage in their community. My role in this particular task was, I don't work for Alzheimer's Society, I don't work for British Standards, and I don't work for the Department of Health. So I got to come in from the outside and kind of be a non-biased point of view to challenge these folks on the steering committee who are all from England and think about, you know, how can we debate the issue of what the definition is and what the components are of a dementia-friendly community. So I reviewed over 60 documents that have been published here in England. Lots of documents from Joseph Rowntree Foundation and some of the local dementia-friendly communities that were earlier on in the process. I visited some dementia-friendly communities and I was really trying to understand the similarities and differences so we could publish the common elements. What's common between them? So I wrote several drafts of the before and after documents, but those drafts went to the steering group, and then the steering group of 18 people from all those different sectors that you saw, and we'll talk about the sectors in a minute. 18 people from all those different sectors went through the document page by page by page and really, you know, criticized and highlighted and had concerns about these areas and that areas. And then we got the steering group together back into a room and we kind of talked to them about, okay, well, it's interesting that, you know, we have these disagreements about the definition, but we have to come to some sort of consensus. So sometimes even within the steering group, people weren't able to agree on things. And the whole purpose was to come to some sort of compromise so we could get something in print that people could follow and have as a current guideline. Not that that guideline can't change in the future, it can and probably certainly will. The other thing we got after the steering group got their hands on it is did another published document, another document not published, and then that document went out for public consultation. So then we got more people, probably about 300 people that emailed in their comments on the public document. So this document's been well debated and argued, and a lot of people have had their hands on this document to really bring it to what it is today. All right, so the controversy, of course, and one of the things that we talked about a lot in the steering group was there's currently a lack of scientific evidence for the issue of dementia-friendly communities. So I think academics and researchers now are starting to look into this issue. They're starting to apply for funding that might look into measuring qualities of dementia-friendly communities. You know, what are the individual components? Do dementia-friendly communities work? Do they not work? These are questions right now we don't have answers to because it's more of a social movement than it is a scientific one. So I don't think that's a bad thing. I just think, you know, it's important to put that up front and to talk about it honestly. We're at the current stage where there isn't any scientific evidence. And because dementia-friendly communities are evolving is another reason maybe, you know, scientific evidence may or may not be the right thing either, because dementia-friendly communities are about what's happening in the community, and those things change on a regular basis. There are other controversies around resource allocation, and basically that means who funds a dementia-friendly community. So I've talked to a few people in England who are, you know, have paid positions to run the local Dementia Action Alliance and get their dementia-friendly community off the ground. And then there are lots of successful dementia-friendly communities that are run by volunteers. And I think it really depends on the dedication of a local person in a community. It depends sometimes on whether that person's paid or not to keep going, because sometimes when people aren't paid, people who aren't paid might be more motivated, but people who are have you know, an investment because it's their job to continue to keep this going. So it would be really interesting to look at dementia-friendly communities that are volunteer-based versus dementia-friendly communities that have the infrastructure where somebody from maybe city government or Alzheimer's Society or, you know, whoever the local social care organization is, actually has a job assigned to creating or helping to create a dementia-friendly community. So that's kind of an issue of controversy at the moment. But at the end of the day, the PAS was created because there's a demand both within England and abroad for people asking, well, what do we do? How do we get started? And we don't know where to go to get started. So that's what this PAS is about. It's to help people get started and start to know what to do and some things to think about. So there are a lot of questions in this PAS to ask yourselves in your own local communities if you want to become dementia friendly. Okay, so the definition. This is a definition that the Alzheimer's Society in the UK uses. And dementia-friendly communities are geographic areas where people with dementia are understood, respected, and supported, and confident they can contribute to community life. In a dementia-friendly community, people are aware of and understand dementia, and people with dementia feel included and involved and have choice and control over their day-to-day lives. A little bit of controversy that we had in the steering group committee also was thinking about, well, what about dementia-friendly businesses and dementia-friendly organizations and dementia-friendly care homes and dementia-friendly this and dementia-friendly that? And we thought those were all good things, but they all make up a dementia-friendly community. So within a dementia-friendly community, you can have dementia-friendly individuals, you can have dementia-friendly businesses, you can have dementia-friendly organizations and services, and faith communities. But the PAS, as far as it was decided in England, has been written with geographic areas in mind. Okay, so that was the boundary that we put around dementia-friendly communities. So the process, there are a few steps to getting the process of a dementia-friendly community up and running if you are looking to do this in your own community. It was decided, and of course there were people with dementia who were included on the steering group, as well as advisory committees of people with dementia that we went to and asked about the code of practice document, that it's essential to include people with dementia and carers on the committee from the start. And I think this group, has had a lot of conversations that I've been a part of over the last couple of years about the tokenistic inclusion of people with dementia. So I would say, a non-tokenistic viewpoint of inclusion of people with dementia is really what the UK or England is established. Other committee members, so again, these are secondary members because people with dementia are first, include shopkeepers, transport providers, faith communities, schools, leisure providers, arts and cultural organizations, housing providers, fire, police, health and social care. Health and social care are key. They're a key part of a stakeholder group, but they're not the only parts. And I think very often in the last 20 years, the leaders of these kinds of movements have been from the health and social care sector. So, this is an attempt to put out into the community some responsibility for becoming dementia friendly and some of the places. And this isn't an all-inclusive list. There might be people missing from this list. And these were also the members that we included on the steering group of writing the paths to begin with. Okay, so the first step is gathering that committee. The second step is, what is the committee going to do? And again, this goes back to the heart of people with dementia. What is it people with dementia in that community want to do? What is it that they think are the priorities? Where are the places they are going from day to day that they're affected and they're not able to engage the way they would like? So for example, in my own research for my PhD, I did 4 focus groups of people with dementia, not about dementia-friendly communities, it's a different topic. But in one of those focus groups, I have a woman who was describing to me her favorite hobby, and her favorite hobby is shopping, clothes shopping. And she loves to clothes shop, but when she went into the local department store and she went into the dressing room had hexagonal mirrors and she couldn't find her way out. And she had to scream and yell until someone came to let her out of the dressing room. And what a horrible experience that would be for somebody with dementia or without dementia, to feel like you're lost and you have to ask for help, even though it's a simple task of, well, I can dress myself, I can get myself into this dressing room, now I can't get myself out of this dressing room. So this hobby, this thing that she loves, she may no longer do anymore just because she had a bad experience in a dressing room in a grocery store. In a retail store. So it's that kind of thing. What are the priorities? So for example, if she were on this committee, she might say, well, my first priority that I'd like to recommend is that we go talk to all of the retail stores in our community, in our town, in our village, wherever we happen to live, and see and do a walkthrough. Are there dressing rooms that have hexagonal mirrors all the way around? Is there good signage? Are the aisles wide enough? Is it dementia friendly in the store, and what does dementia friendly mean to the people on that committee in that store? So that's just one example. The other thing that you can do, and this has to be talked about too, because there are priorities for people with dementia that aren't just early stage priorities. So the example I just gave is somebody with dementia with very early stage who's still able to access her community and be out in the community. But there are people with moderate to late stage dementia who do live in different settings and need different types of dementia friendly interaction. Okay, so there are other ways besides people with dementia sitting on the committee, as they should do, but we should also kind of get an assessment of people with dementia with moderate to late stage and understand what dementia friendly means to them as well, through interviews and observations in different ways that through scientific research, people with dementia have been included in studies to obtain this kind of information. So determining the priorities, that's the important part of stage 2, and using people with dementia as the key providers of what those priorities are. Okay, step 3 is choosing from the areas of action. And I have a list of the areas of action here. They were debated, discussed incessantly for months to really come up with the best all-inclusive areas of action that we could come up with. I will say that they are very similar to the World Health Organization's age-friendly cities. And we did review those as well, putting these together. So there's a good balance and a complementary nature between this code of practice, the British Standard, and the World Health Organization's age-friendly cities framework. The 8 areas for action that we've chosen are arts, culture, leisure, and recreation as one group. We cordon those off together. We categorize businesses and shops together. Children, young people, and students, because that can be, young children in schools, and that can be college students or nursing students, or, other types of students too. So there are lots of groups of young people and students and children in different settings. They might be in Boy Scouts or Girl Scouts or different places that might engage with people with dementia, and we wanted to encourage that as a separate category. We also have number 4, the community, voluntary, faith groups, and organizations. So that's that's a massive sector. That's basically the nonprofit and charity and faith sector all in one. And all of those sectors impact people with dementia in different ways. So it's really important to think about how the different community organizations in your local community interact with people with dementia, and who are the right organizations to have at that table, because they're very, very important. Emergency services was another separate category that we wanted to include, and who also participated on the steering group for the code of practice. Health and social care, housing, of course, and we didn't go into what care homes should be doing differently. This is about people living at home in their own homes, and there are some recommendations on where to go for architecture and environmental changes for that. We thought the care home issue was a deeper issue that other people have already been working on, so this PAS does not cover the issue of environmental considerations in care homes, because those have been considered before. And then transport issues. Again, this is about the community. So if my lady who wants to go to the retail store and do some clothes shopping can't get there, then again, she can't maintain her hobby. She can't do things that she really enjoys doing if she doesn't have the transportation to get her to a certain place. Okay, so those are the key areas for action that were considered. Each of the areas was described in the code of practice in relation to people, place, and process. So for example, how do people in each area for action interact, communicate, and support people with dementia? So in that retail store, she was very happy that, that the woman who came to get her out of the dressing room didn't make her feel bad about it. She apologized for it. Oh, I'm so sorry. That must have been so scary. She gave her empathy. And that's what we want to look at when we're looking at the people within each area for action. How do the people engage, whether you're at the grocery store or a retail store, at the post office, the transport bus driver? These are all people who can be trained to support people with dementia in community settings. And then the second question is place. How do physical spaces in each area accommodate people with dementia? So that's the architecture, the environmental concerns. And like I said, there's quite a bit of research out there already on modifying physical spaces for people with dementia and things to think about. Sterling University is one of the places that has a lot of good information about physical spaces for people with dementia. The third area is the process. So within organizations, and this kind of a good example of thinking about organizational systems would be with fire and police. So emergency services is another interesting thing to look at, where fire and police are trained to better engage people with dementia in their jobs. So for example, if a person with dementia has gone, I'll use the word wandering. I don't like that word because I prefer that people with dementia go out for a walk than wander. But if they go for a walk, they get lost, and a policeman finds them and they're disoriented, that the policeman might think that they have a mental illness, and then they end up in a psychiatric unit overnight, and really this person may have been able to be returned home to his spouse. So it's really important within those organizational systems like fire and police that people with dementia can be supported through training and education of people that are going to interact with them. So it's these systems, the infrastructures, the processes that better support and enable people with dementia, and to think about those. Okay. So the fourth step after the areas for action are considered, and each one of those areas for action is up to the individual communities, by the way. I'm going to go back there for a second to talk about that, because when you start for the first time a dementia-friendly community, maybe you're 2, 3, 4 volunteers, and you don't know where to start. This is again why people with dementia need to be an integral part of the process, because they need to set the priorities. Maybe you think all of 8 of these places need to be addressed in your community, but they can't all be addressed at once. So where do you start? What's the most important? And quite frankly, what's the low-hanging fruit? What's the easiest place to go to first? That, you know, they're already sitting on the committee and they're already keen to do something to change the way that they offer their services. So that's really important to think about too, depending on how large that group is, that stakeholder group. Where you start and how you start is really going to be based on the members of the group that are participating and who you can get involved at the local level. Making considerations for underlying issues. This was another key area that as a steering group we felt the steering group felt very important was included in the code of practice. And language, which I know Dementia Alliance International has talked about a lot and has a webinar on, is very important to people with dementia. And how is that language about dementia already used in the community? Is it negative? You know, is it a work in progress? What role modeling can this dementia-friendly community stakeholder group do to share information about changing the language and how we talk about people with dementia? Within the local community, what are the appropriate geographic boundaries for the community? Is it based on a local county? Is it based on a local village? You know, are several villages getting together and working together to do something similar? You know, those are all questions that need to be answered by the local stakeholder group. The other issues that are highly important are addressing the equal opportunity on the basis of age, disability, race and ethnicity, religion, sex, sexual orientation, socioeconomic status, and other areas for inclusion. So what areas of the community are you serving, and are you making sure that all of the members of your community are being served in some way? And what the priorities are, and base your priorities on that. How is the environment in any given setting providing barriers or facilitators to people with dementia? So again, it's looking at environments in those 8 areas for action. Okay. So the other issue with dementia-friendly communities, and what I'm starting to notice now that there are over 60 dementia-friendly communities here in England, is how do you let people know about them? So that's huge. So we've got a stakeholder group. It's started. It's starting to, you know, pull together some resources. It's starting to go deliver some education and training to local stores and shops and emergency services personnel and within care homes and wherever their target dementia-friendly community areas of action are. But if people don't know your community's dementia-friendly or are striving to be dementia-friendly, then you can't get any further. So you really need to let people know about the information and awareness about, and the media know about dementia-friendliness, what it means, why people need to be dementia-friendly, how many people with dementia are affected in your local community, and that usually also comes with a local story, which can be very helpful. But if you want to become dementia-friendly, you're not telling people about it, then it's going to be really hard to be successful. So that's really important. And then the issue of measurement and evaluation of dementia-friendly communities. Again, right now there's no measurement. There's no, how do we know we're dementia-friendly? In England, the Alzheimer Society does do an awards program every year. They ask for people to submit for recognizing themselves as dementia-friendly communities, and they give awards based on that. So that's one idea. Whatever local organization or local stakeholder group gets together, and how you want to recognize both individuals, businesses, organizations that become dementia-friendly. How you want to recognize yourself as dementia-friendly is going to be based on how you evaluate your progress. How do you know when somebody's been successful in developing their dementia-friendly community? So ultimately, for me, it's about going back to the definition. And that definition is, are people with dementia feeling more understood? Are they feeling more respected and supported and confident they can contribute to community life? Are they a part of the community? Do they feel included and involved? Do they have choice and control in the places that they want to have choices and control? So really it's about going back again to those people with dementia who are serving on the committee and asking them, you know, how are we doing? And that's really important to continue to go forward and creating more and more dementia-friendly individuals and businesses and organizations within a community, is constantly assessing how it's going. And then where do we add next? So maybe we have, you know, we've trained our emergency services. I'll go back to the group again. Maybe we started with emergency services and health and social care, but maybe we don't have dementia-friendly housing or transport yet. So there's always something on the list you can go back to. There's always a place to be working and moving towards becoming more dementia-friendly. So let me just skip ahead here. Where I was. Okay. So that's measuring and evaluating the progress. So this is about working towards dementia friendly. This is from England. This is what they do. They do give shops who have become dementia friendly or working towards becoming dementia friendly a sticker to put in their window. I know there are other groups out there in England as well that use the purple angel to let people know that they've become dementia friendly in some way. They've also put a date on this because maybe you've gone into a retail shop or a grocery store and you've trained the staff once this year, but by next year, that staff is completely turned over. So you need to go back and re-educate people. So does that mean a year from now that that grocery store is still dementia friendly? So it's a continual process. It's always a process of working towards becoming dementia friendly. It isn't something that is successful overnight. It's a long-term process and a long-term investment by a local community. Okay. So a couple of examples that I brought out about dementia-friendly community businesses in the UK are, for example, the first UK bus service. So this is a bus service where the bus drivers have been trained about becoming dementia-friendly. They've been trained about dementia, signs and symptoms of dementia, how to interact and communicate with people with dementia, some of the problems that they might have when they're getting on and off the bus. And they've come up with a tool, and it's a little business card or an ID card that the person with dementia can show the bus driver when they get onto the bus. And that lets the bus driver know that this person has dementia and they might need to be reminded when to get off. So, you know, it's that relationship that's developed with the bus driver who sees this person get on his bus every single day and knows the stop he gets on and knows the stop he gets off. And maybe it requires a bit of a reminder just to let the person know, okay, this is your stop. It's time to get off now. So it's really important. Those little tiny things can make a big difference to a person with dementia trying to stay independent. Another local business that I love in this country is called Dementia Adventure. Dementia Adventure is exactly what it says. It's an adventure and holiday business that's been designed and developed, and I think they are developed as a nonprofit to help people with dementia stay active and do things that they've always wanted to do. They have pictures on their website with people with dementia going sailing and whitewater rafting, which, you know, most people who don't work in the field and don't work with people, particularly in the early stages of dementia, would not assume, gosh, people with dementia can go whitewater rafting. That's just so horrible because we're so risk averse for people with dementia. But I know if I had dementia and if I got dementia in the future, please, please, please take me on a sailboat. Please take me whitewater rafting. You know, I still want to do things. I still want to have fun, but I need that extra support, which is what this company does. So for whatever the fee is, they will arrange for that service to take place, and they'll have volunteers or staff who are trained, who can go and support people with dementia and still having an adventure and an adventurous life. So really lovely business idea that's developed out of that, so people can still have those adventures, and their caregivers or carers, depending on where you live, are really, you know, confident that somebody else has a little bit of responsibility to make sure this person is safe too when we go and do these things. So it's just that extra bit of support that people need. Dementia-friendly supermarkets are becoming more common. There are a couple of YouTube videos from the UK that I've included there as far as links, but also I saw some recent footage from the US, who's now starting to become dementia friendly too. And there are supermarkets that are, have special lanes now. So it's not just the 10 items or less lane. There's a lane for people who need a little more time and patience. And that's really wonderful, opportunity. So somebody with dementia can feel confident going to the grocery store and going in and getting the shopping items that they need. If they need to ask for help, they know they can ask for help. And when they get to the checkout register, if they're having trouble counting their change or counting their money, that the person behind the cash register understands and won't rush them through that experience and will help them out. So some really interesting examples that bring dementia-friendly communities to life there. So I think as far as applying dementia-friendly communities to other areas of the world, still involving people with dementia is what I see and what I hear and what I feel is the right thing to do, and how we continue to do that. That might be more difficult in developing countries that aren't as used to including people with dementia, where the stigma of dementia might be much higher than it is in Western cultures. But still gathering that stakeholder group of community members, and again, importantly, the goal with improving the quality of life for people of and with and for people with dementia. Okay, so as far as the PAS itself, I know the Alzheimer's Society had a limited number of copies because people have been emailing me and asking for it. I don't have any copies, but you can certainly get it either through the Alzheimer's Society if you're here in the UK, or from BSI directly if you're interested. So just wanted to include that on there too. As far as international resources, I think it's really important for people who are studying dementia-friendly communities and looking and comparing and trying to see what's going on with dementia-friendly communities, that you look at the WHO, the World Health Organization's Age-Friendly Cities. That's a good place to start. As well as Alzheimer's Disease International did a dementia-friendly communities report last year, and I think they're in the midst of updating that report soon. So a new report should be out shortly that collates a lot of the dementia-friendly community movements that are going on around the world. So for example, Belgium was the first one, and Japan and the UK and the US, but I've also heard from people from British Columbia, Canada, who are doing it. Certainly, I think Kate is the driver in Australia for dementia-friendly communities, and Germany and Portugal, and I'm sure there's more that I haven't included here. So, and what I think I'd like to do when my slides are done, which is just another slide or two, is really hear from people on the call. If there are dementia-friendly communities in other places or in your community, what's different, what's similar to what's going on here in England, and having a discussion about what is going on in the world around dementia-friendly communities, and whether you feel like if your village or town or city is already working towards being dementia friendly, do you feel like it's a successful project so far? So that's it. There's my email. If anybody wants to contact me, feel free.